And I want to express my gratitude sa mga subscribers. Thank you so much. And for those who did not subscribe yet, please have the generous finger to click the button. And if this is your first time to attend, welcome to Dr. Krell's online class. Hope you will enjoy. Okay? And for our topic, I want to deliver it in a simplest form. Actually, I've been using it since before. At thank you sa mga prof ko kasi di ko siya nakalimutan. Yun yung point doon. Kasi this is the proper way naman eh. Pero hindi ko talaga siya nakalimutan. Tumatak siya sa puso at isip ko. Kahit walang calculator. Yebeng! For that, hello nga po pala sa mga taga University of Eastern Philippines, College of Nursing, sa mga CI ko na nag-train, na di masanay sa calculator. Kasi nga, sabi, walang calculator sa board exam, kaya ganon. Okay? And sa mga kabatch ko, Pearl 99, kumusta kam tanan? Okay, so let's start na. And if you find it informative later, do like, share, and subscribe naman. Okay? So, before we start the computation proper, may I have a little introduction or background in relation to our topic, okay? When we say IV flow rates, it may vary with the types of administration set and the manufacturer of the tubing, okay? So, I have here some of those, okay? At meron silang kanya-kanyang drop factor kung anong administration set yung gamit natin, okay? So, we cannot compute the IV rate without an IV drop factor because it reflects the specific size of the drops of IV fluids that the tubing set creates, okay? And it is also a predetermined number based on the tubing required and available to administer the medication or solution, diba? In a safe manner without overloading the patient. Okay? And class, the most distinct difference between the two is the needle in the drip chamber. Ito here, wala kang na-observe na needle and here, meron. Okay? So, this signifies this is a micro set and this is the macro set. Okay? And macro drip tubing delivers 10 to 20 drops per ml. Ayan. Dito nakalagay. Okay? And it is used to infuse large volume or infuse the fluid quickly as possible. And micro drip tubing delivers 60 is used for small or precise amount of fluids commonly used to delicate neonates and pediatric patients. Okay? So, halimbawa, makikita natin sa doctor's order, sasabihin, give D5-IMB 500 cc at sabihin na natin 40 microdrops per minute. Okay? So, pag sinabing microdrops, ito yung gagamitin nating set. Pag sinabing D5-IMB 500 cc at 40 drops per minute. So, this is macro set yung gamit natin. Okay? Alright. Ito sample. Ayan. In every set, meron nang nakalagay. So, hindi na tayo malilito. Andiyan nakalagay yung 20 drops per minute. Okay? So, yan. So, just to refamiliarize with the set, as shown in the photo, the parts of the infusion set. Anyway, not all sets are look like this, ha? I have it later, yung different types. Pero not that much. Nakuha ko pala yung mga pictures sa different websites, okay? And it is not mine. And no intention of claiming it, okay? So, yan. So, ito yung drip chamber na dapat kilala natin siya. Kasi meron ding mga pang blood transfusion, di ba? So, yan. There are some set na walang Y port. So, we really need to know if we need to use with a Y port or without a Y port. Okay? So, ayan. Flow controller. So, before we use the set, we really need to check if this is well functioning. Baka hindi siya bumababa. Okay? So, yan. So, what is our responsibility if there's an order for IV infusion? Sige nga, anyone? Put it, write it in the comment section. Well, it is our responsibility to make sure that the fluid will infuse at the prescribed rate. Okay? At no patient should have this blood backflow na or na drain yung kanyang IV. Okay? Kasi nakaligtaan or na full blast. Diba? We all know that fluids may be infused by gravity using a manual roller clamp or this flow controller or by using the infusion pump pag medyo may kaya yung hospital. So from time to time, we need to check, lalo na pag bata na malikot or kahit adult na restless, di ba? Or merong mga significant others na nurse nang ipinanganak, doktor nang ipinanganak, di ba? At nagfi-feeling-feelingan. Sorry ha sa mga nakakarinig na naka-encounter na ba kayo ng ganon? Kahit sa patient, di ba? Nagmamadaling umuwi sa patient. Phenol blast niya yung kanyang IV, di ba? Sinasabi ko kanina na set na walang port. So there's a specific set for blood transfusion. We need to observe the drip chamber of the BT set. It has a filter. Ayan yung filter niya. Okay? Oh, what is the purpose of that filter? It is because blood components must be filtered during the transfusion to remove small clumps of platelets and white blood cells that form during the collection and storage. And some clots na din. Okay? So, kahit gaano ka-emergency na kailangan na nating bigyan ng blood sa patient, we really need to use blood transfusion set. Okay? And we should know what is being ordered. We should know what is packed RBC, what is whole blood. Okay? So, dito sa picture natin, ito yung red blood cells, ito yung leukocytes, yung platelets, at yung frozen plasma. Diba? Actually, we have lots of nursing responsibilities before, during, and after the transfusion. Maybe I'll make a different presentation for that. Kasi, maubos natin yung time natin dito. Okay? Anyway, I will include in the computation yung sa blood transfusion. Okay? So, I think my short introduction is enough. Short lang talaga siya, no? So, go na tayo sa ating computation. Baka kung saan pa tayo mapunta. Alam nyo naman, pag sanay ng magmarites, madami nang naisisingit na chika. Baka mapunta pa tayo sa cannula. So, ayan. Let's start. Yan. The doctor's order D5LR 1 liter to infuse over 10 hours. So, the administration set or the drop factor to be used, okay, is 20 drops per ml. What to compute? How many cc per hour or how many ml per hour? Kasi same lang naman si cc at si ml. And what is the flow rate? Okay? Or how many drops per minute you will regulate. So, yan. This is the formula. So, letter A muna tayo. How many cc per hour or how many ml per hour? Ilan yung total volume natin? It's, ilan? 1,000. And, ilang hours to run? 10. Okay? So, yan. Kumuha na ba kayo ng mga calculator? Compute natin. 1,000 divide 10. Tanggal tayo ng isang 0. Tanggal tayo ng isang 0. So, ang natara, 100. So, di ba ang dali lang mag-compute? So, 100. Yan. 100 ml per hour. Or 100 cc per hour. Question. Okay. So, letter B. what is the flow rate or how many drops per minute. So, what is our total volume in ml? It's 1 liter. So, dahil ml yung kailangan, so kailangan natin siyang i-convert. 1 liter is equivalent to 1,000 ml. Okay? How many number of hours? 10. How many is what administration set will use for our drop factor? It is 20 drops per ml. And this is constant. Gustuhin man natin o hindi, andyan talaga siya sa buhay natin. Okay? 60 minutes per hour. And result is the drip rate or the drops per minute. Okay? Depende kung drops per minute or micro drops per minute. Okay? Depende sa doctor's order. But, yan. So, total volume is 100 ml, 1,000 ml. Kasi na-convert na natin yung 1 liter into ml. Then, 10 hours. And, our drop factor is 20 drops per ml. And, 60 minutes. Kasi constant nga. Ay, actually, class, meron pa tayo palang pwedeng ibang formula dito. Depende if it is much easier for you. Same lang naman siya actually. Total volume in ml over total number of hours. Tapos dito na mismo natin ita times yung 60 minutes per hour. Pag nakuha na natin to, saka na natin siya i-multiply sa ating drop factor. Okay? Ayun. Ito, depende sa inyo kung mas madali para sa inyo. Kung halimbawa itong 1,000 ml, i-divide nyo agad sa 10 or pwede din pa ganito. Okay? 1,000 ml times 20 drops per minute and dito na din. Or pwedeng ito din muna at ito muna i-divide. Nasa sayo. Or pwedeng ganito. So, ayan. So, check na natin. So, yung 1,000 ml natin, cancel na yung ml, cancel yung ml, yung hour, yung hour. So, yung natira, drops per minute. Okay? So, ayan. So, 1,000 divide 10. So, tanggal natin ng isang 0. Tanggal natin ng isang 0. Ang natira ay 100. So, meron na lang tayong 100 dito. Okay? And sa ating 20 over 60. So, ayan. 20 divide 60. So, cannot be kasi maliit siya. So, magdagdag tayo ng isang 0. So, naging 200 na siya. So, 3. Diba? 180. So, ang natira 20. Dagdag 0. So, 3 ulit. So, 180 ulit. Ganyan talaga. Hanggang sa magsawa na lang tayo kakadagdag ng 3. 200 divide 63 ulit. So, 180 ulit dito. So, 200 ulit. So, nasa atin kung hanggang saan tayo mag-compute. 0.3333. Diba? So, ayan. So, any question? Okay. So, dito pala, bawa ganyan. 20. Tapos, 2 cancel, kitanggalin. So, same lang. 200. So, same lang sa computation natin kanina, diba? 2,000 divide 6. So, simula muna tayo dito sa 20. So, 3. Ayan. So, 18. Tapos, 2. Down 0. So, 3. So, ganun pa din. 8 and 2. So, magdagdag na tayo ng 0. So, 0, 0. So, 3 pa din. So, ayan. So on and so forth. 33.33. Siyempre, wala namang 33.33 drops per minute. So, it can be 33 to 34 drops per minute. 33 to 32 34 drops per minute. Actually, meron kayong makikitang doctor's order na sasabihin, infuse the 5 LR 1 liter to run at 33 to 34 drops per minute. Ayan siya. Because na-compute na yan ni doctor na it run for 10 hours. Okay, question. Madali lang, di ba? So, ayan. And our next question is, ayan, the doctor ordered the 5 sodium chloride 1 liter at 30 drops per minute. The administration set delivers 15 drops per ml. What to compute? Ayan, how long will it take to run? And example, yung IV natin is na-start ng 3:25 a.m. So, when will it end? Okay, so start na tayo with our letter A. This is our formula. Total volume in ml over drops per minute times, andito na naman, gustuin man natin o hindi, andyan si 60 minutes per hour. Then, multiply it to the drop factor. Yung drop factor natin dito is 15. Total volume in ml, of course, na-convert na natin sa 1 liter into ml, so 1,000. Okay? Drops per minute natin dito is 30 drops per minute. Same lang dito, class. Yung sa formula din natin kanina sa una, same lang yon. Ang papalitan lang natin dito is itong drops per minute. Kanina naman is yung number, total number of hours. Diba? So, yan. Start na tayo. So, 1,000 ml. Ayan. And yung drop factor natin mamaya is 15. Huwag kalilimutan. 1,000 is our total volume in ml. Drops per minute is 30. And yung constant nating 60 minutes per hour. So, cancel na natin si minute at si minute. So, ang matitira na lang is ml and drops per hour. Okay? So, eto, mas madali lang din naman ito i-compute na ganitong i-multiply mo na agad siya pababa. Okay? Halimbawa, 60 times 30, dalawang 0, maglagay na tayo. 6 times 3 is 18. O, diba? Ganyan lang kadali. Yan. So, yung 1/8 natin from 30 times 60 is 1/8. So, 1,000 divide 1/8 is 0.555 ml. Diba? Drops per hour. Kasi yon pa yung mga unit na natira natin dito. And, ilabas na natin si ating drop factor. Ayan, 15. So, cancel na natin si ml, drops. Yung natira, hours. Okay? So, what to do next? Multiply natin 0.555 hours to 15. Okay? So, what is the result? 8.3325 hours. So, naisip mo, paano to? Is this the minutes? Not yet. Gawin pa natin yan. Iko-compute pa natin siya. Diba? So, paano ba natin i-compute yan? Paano makuha yung number of minutes natin dyan? So, ganito lang yon. 0.33 times 60. Dito talaga si 60, di talaga niya tayo iiwan. Okay? Buti pa si 60 minutes per hour, hindi tayo iniiwan. Ayun na nga. So, 0.33 and 60. So, multiply. 0, baba na natin. 6 times 3, 18. So, carry 1. 6 times 3 ulit, 18, 19. So, 1, 2. So, decimal natin. So, ayan. So, 19.80 minutes. So, this can be 20. So, meron na tayong 20 minutes. So, in total, ilang hours tayo? 8 hours and 20 minutes. Ayun, di ba madali lang? So, ayan. Alam na natin how many hours the IV will run. Okay? 8 hours and 20 minutes. Now, kailan siya maubos? And the IV started at 3:25 a.m. Ayan, 3:25 AM na start. Madaling araw pala to eh. Ayan, si nurse hindi natulog. Kasi gising na gising siya kasi nakapagpalit siya ng IV ng 3:25 AM. Saludo ako sa'yo. Ayan. So, kailan siya mag-e-end? So, i-add lang natin yung 3:25 sa 8:20 nating result kanina. Okay? So, 11:45 AM. Add lang siya. 'Di ba? 3:25 plus 8:20, so 11:45 AM. Mag-e-end yung ating IV. Alam niyo maganda din kung nakukompute natin kung kailan siya mag-e-end kasi may endorse natin siya eh, 'di ba? So ayun. Question. Let's go to this is the last question. Infused PAC RBC 300 ml over 4 hours. Then what to compute? How many cc per hour or how many ml per hour? And what is the flow rate? By the way, class, the administration set or yung BT set, yung blood transfusion set, is nakaset na talaga siya sa 20. Okay, 20 drops per minute. Okay, walang infusion set na naka-micro drip. Okay, wala. And, PAC RBC, pag sinabing kindly infuse 1 bag of PAC RBC, hindi siya 500 ha. Kasi, yung PAC RBC na yan, na-remove na yung plasma. Okay? Minsan, sa 500cc, yung plasma is nasa 200 to 250 ml na plasma from the whole blood. Okay? So, typically, volume in 1 bag for PAC RBC is 250 to 300 ml. Okay? And the maximum time for blood transfusion is 4 hours. Yan. And for the first 15 minutes, we need to slow down first the infusion. Okay? Kung halimbawa 20 drops per minute, 10 drops muna natin. Okay? For 15 minutes, that is to observe for any reaction or any body reaction from the blood na na-transfuse natin sa patient. Then after 15 minutes, okay yung BP, hindi si patient nagka-rashes, hindi tumas yung temperature, so we can start the actual computed flow rate na. Okay? Ayan. And so start na tayo. Yung total infusion volume is 300 ml. And total infusion time is 4 hours. Okay, then result will be ml per hour. So, 300 ml over 4 hours. And it is the maximum time to infuse is 4 hours. Okay, so 300 divide 4. So, 75 ml per hour. Okay, yan. So, at least alam na natin ilang ml per hour. So, hindi tayo magkaka-over infused. Okay? And it is much better kung naka-soluset kasi makikita talaga natin yung 75 ml. Okay? Yan. So, what is the flow rate? So, bakit tayo nagkaroon ng 240 minutes? It is the 4 times 60. Okay? Because we converted the 4 hours to minutes. Sige nga. 60 times 4. So, 0 and 6 times 4 is 240. So, ayan. So, meron tayong 300 ml for the volume and 240 minutes. So, what will be our drop factor? Sabi ko nga kanina, isa lang yung drop factor or isa lang yung administration set ng pang blood transfusion, that is 20 drops. So, 20 drops per ml. So, dito, pwede din naman natin munang 300 times 20. Nasa atin lang yon kung mas mabilis natin i-compute yon or 300 divide 240 muna tayo. Okay? So, cancel natin si ml, cancel si ml. Ang matitira na lang is drops and minutes. So, 300 divide 40 is 125. Okay? Naka-minutes na lang yung unit natin kasi na-cancel na natin si ml. And, multiply it by 20 drops. Drops na lang kasi nawala na si ml. Okay? So, ayan. 125 minutes times 20 drops is equals to 25 drops per minute. So, now, we know that it's 20 drops per minute. So, for the first 15 minutes, at least, pwede tayong mag-infuse ng 12 drops per minute. Then, after 15 minutes, saka na tayo mag-infuse ng 25 drops per minute. And, even after 15 minutes, kailangan pa din nating i-observe si patient. Okay? Yung kanyang blood pressure, yung reaction ni patient sa blood, kung may rashes, okay? So, ayan. So, all throughout the 4 hours, balik-balikan natin si patient. Ang hindi lang naman binabalikan yung mga X na eh. Okay? Pero pag hindi pa naman X, balik-balikan lang natin within 4 hours. Okay? Okay, class, I'm not saying X na dead sa yung mga X natin. X nyo pala. Naisingit. So, ayan. So, any question? Any question, class? Ayan. Actually, dito, pwede din yung mabilisang formula, yung halimbawa, volume divide time. Okay? Volume divide time times draft factor. Ayan. So, results niya yung drops per minute or yung IV rate. Okay? Same lang naman talaga siya. Basta, let's just make sure na we will convert the hours into minutes. Kasi minutes yung nasa formula natin. Question. Actually, pwede din to sa IV. Okay? Itong formula. Ayan. So, assignment na tayo. Ayan. Number 1, D5-IMB 500 ml to infused over 6 hours. The administration set delivers 15 drops per milliliter. How many cc per hour and how many drops per minute? Yan. So, number 2 question, D5-LR 1 liter regulated to 34 drops per minute. The administration set delivers 10 drops per ml. Then, question, how many hours to consume? And it started at 9:05 a.m. When will it end? Third question, pack RBC 200 ml over 4 hours. Question, how many cc per hour? And what is the flow rate? Ayan. So, class, write your answer in the comment section. Tingnan natin kung nakuha nyo na. Alam ko namang kuha nyo na yun eh. Kasi magagaling naman kayo eh. Diba? So, ayan. Madali lang naman. Basta naintindihan lang natin yung formula at alam natin yung process, paniguradong papasa na kayo sa board exam niyan. Yes, we're done. Thank you for watching. And if you find it informative, do like, subscribe, and share na din. And I just want to say, be informed, be knowledgeable. Okay? And bye-bye for now. See you next time. See you. Hindi ka nakalabas yung mukha ko eh. Kasi hindi pa ako ganun ka-confident ilabas yung mukha. Sorry naman, class. Sige na. Bye-bye.